The Daily Bruin spoke with the executive director of the Arthur Ashe Student Health and Wellness Center about COVID-19 safety protocols for the holidays.
Hi, I'm Chaitali Mukherjee. I'm the executive director of the Arthur Ashe Student Health and Wellness Center.
Thank you, Dr. Mukherjee. So just to start, students are now returning from the Thanksgiving holiday. What advice and recommendations for COVID-19 protocols do you have for them?
So the advice for students is to make sure that you are fully vaccinated. Go ahead and get a booster shot if you're eligible. And if you have traveled, it is important for you to get a COVID test 3 to 5 days after returning.
Speaking of booster shots, does the Ashe Center recommend that all students that are eligible get the booster shot?
Yes, and it is possible to go ahead and schedule those appointments online through the Ashe student portal. We have the Pfizer vaccine available in stock. And LA County also just approved students who have not previously received FDA approved vaccines. For example, many of the vaccines that have been administered internationally, you are now eligible to get the FDA approved vaccines at the Ashe Center as well. So I encourage that.
Is there an expected winter surge on campus for the flu or for COVID-19?
We actually saw some COVID cases go up a bit after Halloween. So it wouldn't be a surprise if we did see them rise again after Thanksgiving, given the fact that people would be traveling a little more than typical. So we did make some preparations to ensure that folks had easy access to testing upon returning back to campus. And I just encourage folks to take advantage of those resources.
And speaking of the flu, has there been any reported case of influenza as well on campus yet?
We have not had any cases of influenza diagnosed at the Ashe Center yet. And per my colleagues at UCLA Health on the infection prevention team, there has only been one reported case. However, the CDC just issued a health advisory on November 24th showing an increase in seasonal influenza activity, especially among young adults and college students. So, we are seeing a co-circulation of both COVID as well as flu that's anticipated to spread. It's just not quite here yet in Los Angeles, but is anticipated to become more noticeable by the end of this month, as well as early, in 2022.
Now moving back to COVID-19, so we're more than 97% of students vaccinated. So are most cases on campus being considered breakthrough cases? And with regards to that, should students who are vaccinated still be getting periodic tests?
Yes, most cases are breakthrough cases because that's just the population that we have here since the majority are vaccinated. We do always recommend students to go ahead and get testing. It's not mandated at this time unless you are unvaccinated, because that's where the risk of more severe illness remains. But yes, once weekly is something that's advised for anyone that is coming to campus.
And speaking of testing, how many people are on average getting tests every day at UCLA for COVID-19?
Well, you know what? Actually, it's been hovering anywhere from 15 to 16,000 tests per week that we're doing at UCLA. And the average per day can sometimes vary depending on what may be going on. So, we saw obviously increased testing prior to, the Thanksgiving holiday, as people were rightfully getting tested before they embarked on any kind of travel. We also saw uptick in testing after Halloween. So what I think that really shows and demonstrates that, the campus is taking, the pandemic very seriously and availing themselves of the opportunity to have the access to testing, so if they know they've been in close contact, unmasked with folks, that they are aware of what their status is before they engage in any social activities.
For students who might not be feeling well and they need urgent non-COVID-19 medical care, what is the best approach for them during these next couple weeks still on campus?
The Ashe Center is open and we are ready to see them. We have appointments available in person as well as via telehealth. So the most efficient way is usually to go to the student portal where you can book appointments online. You can also get appointments for the booster. You know, if you still haven't received your COVID booster, or if you haven't received your flu vaccine or any other health maintenance issues. A lot of those things can be done without actually necessarily seeing your primary care provider. You can schedule an appointment with the nurse or just directly into the vaccine clinic. After hours, our website has some options for local urgent cares that you can use. Those students who have the UC SHIP plan, the Student Health Insurance Plan, are eligible also for Live Health Online, which is another telehealth service, which is available also for students who don't have SHIP, but there's a copay for those visits for students who don't have the insurance plan and none for those who do.
And this has been a busy quarter, a lot of vaccinations for students and getting prepared for immunizations. What are the goals for student health for winter and for spring?
Well, for winter and spring, we want to continue to keep the campus and our students healthy. And so to that end, we're going to continue to increase access to just services. We are in the process of hiring more providers. And so I'm very excited to also announce that we have a new incoming medical director that's going to be beginning on December 1st. As well as several new providers. And so I think that's going to also help reduce wait times. And so we're hoping to engage very closely with the SHAC, the Student Health Advisory Committee, to set priorities for the rest of the academic year that are aligned with the needs of the students.
As students are preparing for the winter break and traveling, what precautions should they keep in mind?
I think it's really important for folks to really take good care of themselves and rest as much as they can over winter break. Fall quarter has been a big adjustment and really busy. It's important, with COVID as well as influenza season upon us, to ensure you're fully vaccinated, get a booster shot if you're eligible, make sure you're testing if you travel. And, that's all we can really do to take care of ourselves, our friends, family, and our community. So I just encourage everyone to keep up what you've been doing and to remain vigilant. And, in the coming months, I think that's just going to help us really respond as we have, to the pandemic in a way that allows us to keep classes open, keep the campus open, and to really recover and move forward from the pandemic.